Let's move into our medical segment this morning. And we turn our attention to prostate cancer. And according to the World Health Organization, prostate cancer is the second most common cancer that is diagnosed amongst men globally. Well, this was in 2020 with over 1.4 million new cases. Alarmingly, Africa carries one of the highest prostate cancer mortality rates, with Southern Africa seeing a 60% increase in cases over the past 15 years. Now, in South Africa alone, prostate cancer is the most commonly diagnosed cancer among men of all races. And joining us to talk a little bit more about this is Urologist Dr. Nicholus and Nkosi from Verna Private Hospital in Ladysmith. Dr. Thulani, thank you. Thank you very much for your time.
Thank you. Welcome you, Leah, and your viewers. Thanks.
So, I mean, prostate cancer is one that is very serious. And I mean, through the statistics that we're hearing, perhaps it's even more serious than we think it is. And, you know, are you finding that this is something that's taken very seriously by individuals with the numbers that we're talking about?
Most individuals, they routinely come quite late because our society and the awareness, perhaps it does not reach certain areas with high rate of illiteracy. So people generally, they need to come quite early because there are early signs and symptoms of prostate cancer that a man from age 40 to 50, they need to come as soon as possible, especially when they have lower urinary tract symptoms, which is irritative or obstructive symptoms. The irritative symptoms are frequency, agency, and dysuria. Some of the other symptoms which are obstructive in nature, you have got a weak stream, you have got straining, you have got post-voiding dribbling, and you have got patients who present also with a contributory effect of erectile dysfunction. Some, they can have microscopic or macroscopic hematuria without any signs and symptoms of urinary tract infection. And when they come quite late, they can come with already paralysis with other complications of obstructive renal failure.
Yeah.
I hope a lot of patients will soon gonna start to come quite earlier because this is the most aggressive cancer, as the stats have put it.
Yeah, it certainly is. But I think what's important is that it is, in a way, avoidable. And that's why you urge men to go for, what would we say when we say regular checkups? I know you gave it from the age of about 40 onwards, but how often should men go and have their prostates checked out for?
Men need to come from age 40 to 50 on a yearly basis.
Okay.
To come and see a urologist for further checkup. Firstly, those with a higher risk of prostate cancer, with a strong family history of prostate cancer, and some of the patients with already having symptoms which points towards either irritative or obstructive symptoms, and some who have been reported to have either microscopic hematuria from their checkup by the GPs or macroscopic, because ideally a patient shouldn't have those symptoms. And some of the cases, you have got hidden cases where they have got erectile dysfunction, so they need to come as soon as possible on a yearly basis, where we check them when we do a digital rectal exam, as well as take blood for PSA screening, where we do PSA. And the PSA is age-specific. From those who are age 40 to 50, the PSA range, a normal range is from 0 to 2.5, and those 50 to 60 years of age is 0 to 3.5, and those above the age of 60 is 0 to 4. If they have got high PSA, then they will need further test where we do a prostate biopsy and we send it for histology, where in the laboratory they're going to tell us exactly whether they have a prostate cancer or not, what type, how aggressive it is, and other prognostic features on the histology itself.
Yeah.
And then we can take it up with a better treatment.
Doctor, is there a population group that is more at risk than others, and perhaps who is at risk to get prostate cancer?
Patients that are at risk of prostate cancer, firstly, is the age, the race, those with strong family history and genetic predisposing factors to have a prostate cancer, especially blacks. It tends to be highly aggressive prostate cancer, and when they present quite late, we might pick it up quite late when it's already metastatic. Yeah. So our population needs to come as soon as possible for a routine checkup of a prostate cancer. So blacks are more likely to have more problems compared to whites, because there are certain theories why we have that. They normally say because we have melanin, so by the melanin we have less vitamin D, which is regarded as chemoprevention in a way. So blacks, they tend to have prostate cancer, and it tends to be highly aggressive with them. Yeah. But generally, men from age 40 to 50, they need to come early, and those with relatives, especially the daughters with breast cancer, the males, the fathers, they need to come quite early, because there is a strong relationship between the breast cancer and the prostate cancer. For some strange reasons, it tends to be higher in those patients.
That is fascinating. That is something that I must say I've never heard of. Let me flip that coin. If, say, my father or somebody in my family, a male in my family, has got prostate cancer, would I be at a higher risk of getting breast cancer?
Especially the daughters, the fathers are more likely to have a problem to develop a prostate cancer. They need to come earlier for a screening, especially from age 40, for a yearly screening with a PSA and history of excluding any symptoms and digital rectal exam. If there is any abnormality, then they can be done a biopsy and exclude a prostate cancer.
If we have a look at sort of the whole genetics of this, and I think you've given us a valuable piece of information there about a relation between a father and a daughter, but obviously would one say that if in fact for a father and a son, if the father does have, or the grandfather has got history of prostate cancer, that the next generation would possibly be at a higher risk?
Yes, definitely they will be at a higher risk, especially when there is a strong family history. If the first-degree relatives have a prostate cancer, like father, like son, so the sons are more likely to have a prostate cancer.
Okay.
So they need to be screened quite earlier than the rest of the population.
Let's talk treatment options. Obviously, if you catch this in time, and I saw a good graphic on the screen basically saying that if it's caught in time, it's 99% treatable, and people that do have it can lead a very normal life. So perhaps we can talk about catching it in time and how we treat it.
The prostate cancer, when it's catched in time, when it's still localized, there are options where you can easily treat the prostate cancer. And it can be cured surgically or using radical prostatectomy, either robotic radical prostatectomy, or it can be done radiation in a form of brachytherapy or external beam radiation. And some of the patients, especially those with low grade who are not so much at high risk, you can do an active surveillance for them.
In terms of
so
sorry, please carry on, doctor.
Yes, so those are the main options that we have for the localized prostate cancer.
Yeah. Are there any lifestyle changes that men can embark on from an early age that can perhaps prevent prostate cancer from developing?
Firstly, lifestyle, healthy lifestyle and diet has been one of the key things which have been highly recommended, that you need to eat healthy food. You need to also exercise, stop smoking, because smoking can predispose a person to have a lot of carcinogens, and you are more likely to have prostate cancer. And when you exercise and you are not obese, you are prone to prevent this kind of a condition. And when you are obese, you are eating high animal fat, and you don't watch at your diet, you are more at higher risk of developing this kind of a condition. So eating all the green teas and the soya and taking all the vitamin D supplements, as well as eating healthy and looking after yourself, is the key in this case. And when there is a strong family history, you need to be checked as soon as possible rather than later. And a lot of patients who look after themselves, they really do extremely well, and they are able to be helped as soon as possible.
All right, we leave it there, Doctor. I think you've given us some great advice for those to prevent prostate cancer and for those to go and get those examinations to make sure that if in fact you do have it, it is treatable and you can look after it. But lifestyle choices, very, very big decision that you take every single day of your life to make sure your health is good. Doctor, thank you. Thank you very, very much for talking to us. That was urologist Dr. Nicholus Thulani Nkosi from Verna Private Hospital in Ladysmith. Alarming statistics. They're very clear. 1.4 million new cases worldwide in 2020, a 60% increase in Southern Africa, and the #1 diagnosed cancer amongst men in South Africa. And that, of course, remember, early diagnosis is the best way that you can do it, and make sure that you go to your doctor for screenings.